All, this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. So we continue to have our discussions from the road show. Quick update for the patient. She's doing much better. Plus, she has been able to take a break and figure out how to put the services around her. For example, folks who can come in and help her with laundry and with dishes, physiotherapists, nursing staff who can do home care. So she's mostly now set with those. Plus, her family members, her friends are now arriving as well. So I hope that by tomorrow the services would start, and I would probably then go back tomorrow. And with that, if I traveled tomorrow, it is about 10, 11 hours. So if that happened, I would try to get out as soon as possible in the morning, but it still might take till 7, 8 in the evening. So I might miss the lecture tomorrow. So I would I would let us know, but it is possible that tomorrow we would have an off, and then we'll continue day after. So with this, let's start a discussion. The context to this discussion is the following. Sorry, I just saw a comment, so I started reading it. So the context of the discussion is the following. There has been a lot of discussion about the possibility of infection in a person who is not infected or vaccinated, then a possibility of reinfection in a person who is vaccinated, and the possibility of reinfection in a person who was previously infected. There are three terms that have been going around. One is the term reinfection, the other term is breakthrough, and the third term is escape. And I wanted to make sure that, number one, we can look at some of this data to wrap our head around this together collectively if we can see the data, number one. Number two, a little bit clarity on what do we mean by breakthrough, or how is CDC looking at breakthrough, and does that really mean, as we take negatively, as escape? So these are the discussions. So let's look at that data together. And here are the references to the data. And you can actually look at that data right now and make an opinion, and I'll show that in a tabular form as well. So this is the study. It is an approved and published study. It's not a preprint. It is from Qatar. This study is done on about 200,000 people. So it is a large scale study. And this study showed, and we talked about this study a couple of days ago, this study showed that efficacy of natural infection against reinfection was estimated at 95.2%, and the confidence interval is 94 to 96%. So keep this number in mind. I'll show it to you again too, but please keep in mind, this is the second study. This is Pfizer study from Israel, and it was about 1.2 million people. So about 500,000 or 600,000 people in two groups. One group was vaccinated with Pfizer, other group was a control group or not vaccinated folks. And if you see here, 7 days after the second dose, the vaccine effectiveness for documented infection, symptomatic illness, hospitalization, and severe disease was 92%. Now, one difference between these two data points. Here, this efficacy is looked at from the day of infection till 35 weeks after that. So a longer period of continued exposure and testing, and then seeing where the infection rate stands. In this case, the infection is observed 7 days after the vaccine. So there is a time period difference which can nullify my comparison over here, which is fine. Once again, even if we stand these two numbers on their own separately, they still have an efficacy that could be looked at. And that efficacy in one case is 92%, in other cases 95.2%. I would compare them to be almost equal. Then there is another data point. and that is here. This is also the Qatar study. But in this study, I want to see one more data point here. And that data point is uninfected people. Assume them to be uninfected plus unvaccinated. What is the percentage in them? The percentage of infection is 3.1%. So we're not talking about efficacy, we're talking about 3.1%. Of course, the efficacy, as I just mentioned, is 95% protection in naturally infected over over uninfected. Then I want to show one more data point, and that is here. This is Oregon live. And again, I do not know how good this is. I am actually right now in Oregon. 2% of Oregon's COVID-19 infections are breakthrough cases in vaccinated people. So just want to share that, and I would close this. Then I want to go to other references that I have. So starting from here, this is drbeen.com. If you would like to continue to study these lectures, you can purchase a subscription here. This is the CDC breakthrough rate, and we're going to talk about this. This is CDC's breakthrough rate from January to April 30. This is breakthrough rate from, I believe, May onwards. And there is a difference in their tracking of the breakthrough rates before May and after May. And then this is the same study as I just showed you, the Qatar study. And this is another study, but this is a preprint, not very, very important right now for us. So here we are going to be looking at this. So now, first, let's look at the data. Summary is the following. Vaccine and infection recovered, that is convalescent patients, both provide significant protection from serious reinfection. So that is the data which can be seen in both studies. So when anyone, cool bean or not, when they feel that I should take a position, or we all should take a position to say either the vaccine protects better than the real infection, and somehow real infection's protection is inferior or lacking, they are incorrect. Similarly, if somebody says that a person who was infected naturally is a better thing compared to vaccine, that is also an incorrect footing position, because a natural infection can cause a person to die, or it can cause a person to develop a long haul syndrome. It can even cause a person to develop chronic diseases. So natural infection is not a fun thing to wait for, to say, I would just take a risk with that. There is issue there. At the same time, vaccines have their issue as well. And at the same time, in terms of efficacy, this trying to push a vaccine to say it is a better thing, it is a durable thing, it is somehow superior, that also is not the best thing to do. Vaccines are important to protect from serious disease and death, post-COVID sequelae, or post-COVID syndrome or long haul syndrome. Now, data. This is the small table, and then I want to go over the CDC's data itself. So look, here is the data. What I've done is I have taken CDC's data that I would show you in a second. I've taken the Qatar study as well. I didn't put the Pfizer data here, but you know that efficacy is about 92%. So let's look at CDC. CDC says that since the tracking, so actually let's go to the CDC site for a second and understand how they're positioning themselves. What CDC said was, so this is January 1 to April 30. January 1 to April 30. In this time frame here, as of April 30, approximately 101 million persons in the United States had been fully vaccinated. So that is the baseline number. Then if you come here to this paragraph, this paragraph here, a total of 10,262 SARS-CoV-2 vaccine breakthrough infections had been reported from 46 US states and territories as of April 30th. couple of important concepts to discuss here. Number one, is this all? Is this the whole total number of infections? No. So CDC themselves say that the findings in this report are subject to at least two limitations. First, the number of reported COVID-19 vaccine breakthrough cases is likely a substantial undercount of all SARS-CoV-2 infections among fully vaccinated persons. So number one, they're saying that, hey, we actually do not know what is the total number of reinfections that occurred. If I use their term breakthrough that occur, they are saying that this is a voluntary reporting, and in this reporting, and this is a passive reporting, in this reporting, we know this much. So they agree on this one, that this is a substantial undercount. So picking up this data and saying, you know what, this data is the end all and be all data to prove what should be the reinfection percentage. I would actually take Qatar study or Pfizer study and use them as a better data point than here, because here the data presenter themselves are saying this may not be an accurate data. The second thing here is SARS-CoV-2 sequence data are available for only a small proportion of the reported cases, meaning CDC is not very well positioned to say, was this variant of kind 1 or variant of kind 2, or is it a variant that is causing an escape or breakthrough or not? They're not very much sure. They have less data. Then this is also important, and I'm going to explain a little more what breakthrough do they mean. But look at this. They're saying beginning May 1, CDC transitioned from monitoring all reported COVID-19 vaccine breakthrough infections to investigating only those among patients who are, I'm sorry, whenever I do this, who are hospitalized or die, who are hospitalized or who die. So what they're saying is we're not actually counting all the cases. So once again, all those folks who would just pick up this number from here and then say the percentage is this 0.000 this percent. Well, CDC themselves are saying that we are switching from counting any reinfection that is not resulting in hospitalization or death. Which means two things now. Number one, CDC was already not counting every reinfection or breakthrough because they said this is a passive reporting. Then they even stopped doing that and are only counting those who may be in hospital and were fully vaccinated and found out in the hospital that they had COVID, or accidentally, asymptomatically, they were there for something else, let's say heart attack, and they also found out, the hospital folks, that this patient had COVID as well. So these are the limitations of the data from here. So can we pick up this data and start shouting that, you know what, the percentages are really low? I don't think so. But we should still consider this data over here. Then in May, they started talking about hospitalization only. So here, this is the data from May 1st onwards, when the total people who are vaccinated are 135 million. This data only considers those people who were hospitalized either because of COVID or because of something else, and during the routine labs and tests, COVID came back positive as well. What is that data over here? The most important part is hospitalizations and deaths. That is 2,854 hospitalizations out of 135 million vaccinated people. And deaths are 535. And then there is one more couple of things here to notice. Number one, down here, if you see, 654 of the hospitalized patients reported as asymptomatic or not related to COVID-19. And then 588 of 535 fatal cases reported as asymptomatic or not related to COVID-19. So this is the CDC's position. And I see people who are taking this number and then tweeting about this and then saying, hey, look, This is how robust vaccines are and totally cool. But this number here does not or cannot be compared to numbers here. For example, the Qatar study. Why not? Because in Qatar study, they took 200,000 people. They kept testing them weekly for 35 weeks. So this was not an accidental finding. This was not a passive reporting. They were actually following them. And these were naturally infected people. And then they came back and they said efficacy of natural infection is 95%. So conclusion is what? Conclusion is that not natural infection or vaccine, their protection is similar. Yesterday there were some folks who were really protesting that why do I think that vaccine is similar to infection while Fauci says that vaccines are superior. And as much as I am vaccinated by myself, my family is vaccinated, I believe vaccine should be taken instead of taking a chance with the actual infection and ending up with the chronic damages to the organs, or to becoming long hauler, or to actually having a disastrous outcome of death. So that is my position. But at the same time, twisting and manipulating data is also not the best thing to do. And people who come up as scientists and then manipulate the data or do not even read the data correctly, that's just not right. Now, with this, I want to talk about what do they mean by breakthrough cases. So there are three things that we should now, cool beans, should become aware of. These three things are, number one, what is reinfection? What is a breakthrough? And then what is an escape? These are the three terms that are important. So CDC's definition of breakthrough is the following. They said, for the purpose of this surveillance, a vaccine breakthrough infection is defined as the detection of SARS-CoV-2 RNA or antigen in a respiratory specimen collected from a person more than 14 days after they have completed all recommended doses of a FDA authorized vaccine. That is a breakthrough definition. This definition should not scare us, or listening to the word breakthrough should not scare us, because what they're really calling breakthrough is the reinfection. And we have been talking about this, that the reinfection is actually possible. And natural infection or the vaccine, what would happen is, here is a person, they are protected, let's say because of a vaccine. And we have done this discussion almost on daily basis. The person can receive the virus in their mouth from another person, or their nose or their eyes. There is nothing that is going to stop that other than masks or shields and stuff like that, or social distances. If they're going to be near someone and that person has COVID, this person is going to get COVID, or not COVID, SARS-CoV-2. Then that virus is going to sit here. Let's say this person is not, we talked about this yesterday too. Let's say this person is, their immune system has gone to rest after developing the protection. So that means, let's say 2-3 months after the vaccine, or 2-3 months after the infection. Now, when the infection arrives, when the SARS-CoV-2 arrives, what happens is immune system cells are going to take time to wake up. How much time? 24 to 48 hours. We talked about that yesterday as well. During this time, SARS-CoV-2 will have a chance to get into the cells and infect them, then come out of them, then get into other cells and infect them and keep spreading. And when that spread is occurring within the respiratory system, and where the actual spread occurs, and then when that person would breathe, cough, laugh, sneeze, they would shed it back. This, in CDC's point of view, is a reinfection if you tested it during this time and you could pick up the SARS-CoV-2. So could you pick up SARS-CoV-2 during this 24, 48 hours window? Yes. Could there be a situation where the actual infection actually continued on? So this is after 24 to 48 hours, when immune system wakes up, immune system can actually control this whole thing and stop it. This reinfection or breakthrough, this is the previous definition of the CDC's breakthrough, that anybody who became infected, who was found to be positive, regardless of their severity of the disease, they called that breakthrough before. And this is reinfection. This can be called breakthrough as well with the CDC's definition. However, that case where a person actually ends up in a state where they become severe and they become hospitalized and they die, this is where the question should, and that is why I think CDC has started focusing on this. They don't care for anything else. This is where the question should be, that is this a mutation in the virus which did not allow the protection to work? And here we are talking about the vaccines. This could happen with the natural infection as well, as we saw in the Qatar's case. The only thing in the Qatar's case is that we did not see people becoming seriously infected and dead, but at the same time, there were only 50,000 people they were monitoring. Here we have 135 million people. And so the death rate is really very, very, very tiny. But this death rate or this hospitalization is a fair thing to look at, to say, did a variant do it? Was this an escape? So now I want to bring in the concept of escape in here. Was this an escape from the immunity? Or was it a person's immune system compromise? Or was it the person's body's situation, and so on? So there could be many, many reasons, not just the escape. So now I want to elaborate on the escape. Escape will be when the virus has changed so much that the immune system tried to catch it. The immune system that was trained to catch it with the previous infection or vaccine is not able to catch this anymore because the virus has changed significantly to not be caught. Then this has escaped. So now the question is that these cases, were they because of escape, or were they just simple breakthroughs, meaning reinfections, but the person was not able to manage that? Maybe their immune system was not capable of it. Maybe after the very first vaccine or the infection, they did not develop enough immunity. Maybe the vaccine did not develop enough immunity. Maybe this was a variant that they could not handle. So this all is a good question mark. And if we expected the CDC to come back and give us a good answer around that, I doubt that, because I think they would continue to say what they're saying today. They're saying, we are working to understand more. So maybe there will be some studies that would come out in the future. But this is the basic discussion. So what is the takeaway from this whole thing? The takeaway is, this is incorrect for anyone, including me, to stand up and say vaccine is superior to infection in terms of protection. Vaccine is superior from infection only in the terms of, and very importantly, that is why I have vaccine and not looking for the infection, preventing the death and long haul and sequelae. But in terms of preparation of the immune system and the robustness of the immune system, they both are equal. Actually, if I take a position here, Qatar study actually showed that natural infection was 95.2% efficacious, and Pfizer study showed that the vaccine developed protection was 92% efficacious. So this is the discussion for today. I think I will be off tomorrow because I'll be traveling. So I'm going to hang up now and then come back here for the quick chit chat. So Roman says CDC equals creative data crooks. So please like, subscribe, and share. And if you would like to support this work as well, then there are 3 links in the description. One is to buy me a coffee. You don't have to use a PayPal to buy me a coffee, or you can use PayPal to support this work, or you can become a patron as well. So thank you very much, and I would see you once again. There is some discussions going on here which are interesting. Kelly, so the tanning and the this is the camera. The camera has just decided. So this is on auto calibration because the webcam. It has decided that given this background and the light, and I should look like this. So that's the camera. And haircut is my wife. So Eileen says, why, great doctor, is there such a worry now with this disease or variant or escape when ivermectin plus zinc are effective in early treatment? So we have done this discussion multiple times before. I would just do this for rounding out our talk here, and that is ivermectin studies efficacy is anywhere from 74% and above. So that means there is a part of community that will not be protected fully by ivermectin. Similarly, vaccines also have 94-95% efficacy, correct? Some even lower, for example, 6-7% in case of Johnson Johnson. That means they also leave a part of the community that will not be protected, and we just saw the numbers. Not the entirely accurate numbers, but still we saw the proof. Then if we take, let's say, vitamin D, latest studies are showing protection from death 50% or more. That means there still is a chance of a gap in protection, meaning none of these things are cures. They are protections, they are protective, but they are not fully the last answer. And similarly, if you take social distancing and mask and all those, they also have a limited role to play. So because of this area can actually happen with a person who is taking ivermectin. Take my example. I hate to give other people's examples. I am vaccinated. I've taken ivermectin. I've taken vitamin. I do social distancing as well. Am I still comfortable that I would not get it? No. Am I crazy? No, I understand the mechanisms, but I also understand that there are gaps in all of these protections. It would be great if one's gap is overlapped by the other strength, and then I'm protected. But it is also possible that the gaps are overlapping each other and we are not fully protected. So that is why. So M. Gregory says, is there a cure? So as you can see, there is protections. There is no cure. Even vaccine itself is not the cure. Nairi says, we love you, Dr. Bean. Thank you for your time. You're very welcome, and love you too. France says, ventilation, Dr. B. Yes, absolutely. Ventilation, yes. Samantha says, you're over medicating yourself to fight a non-fatal disease. Sorry, no logic here. Samantha, actually, you're correct. No logic there where you're speaking from. You don't have to be sorry for your no logic. So Roman says, Jax, the only thing, okay, so there is some discussion going on. Terry says, when will the boosters be needed? Boosters will be needed. I'm going to give you a cynical answer and a technical answer. Cynical answer is when they want more money, they'll create boosters. Technical answer is when there is a variant escape or there is a variant change sufficient enough that the current vaccine's efficacy has dropped or current infection's efficacy has dropped, then the booster would come in. So not a sheeple. I'm totally good if you're not a sheeple, but at least be thorough in your understanding of the things. So when you say absolute risk reduction, numbers are between 0.7 to 1%, not 90%, which is very correct. But do you realize that the way absolute risk reduction is calculated is that you look at the baseline. So, for example, I believe it is the Pfizer vaccine. The baseline of the infection rate in when the Pfizer vaccine trial was done, I believe, and I'm speaking off the top of my head, so I may be wrong in the numbers, but they're going to be very close. I think that that number was 0.8 or something percent, 0.8%. And then after the vaccine, the number went down to 0.04%. 0.04% risk of infection. That is what happened. Now, if you do absolute risk reduction between them, it is 0.8% minus 0.04%, which is 0.76%. So now, when somebody trying to protect you from being a sheeple, they say, you know what? 0.76%, it's lesser than 1% efficacy. They are wrong, because the baseline is 0.8%. And reduction is down to 0.04% from 0.8%. Do you understand what that means? What that means is that 0.8% means out of 120 or 30 people, 1% will become infected. And 0.01% or 0.04% means you can just divide it by 100 and know out of 2,500 people, one will become infected. This is vaccine and this is not. This is absolute risk reduction, what it means. And when not sheeples do not understand it, then what they do is that the scientists divide these two and say the difference between these two numbers is 95%. Okay, so let's hang up for now, and I would come back for a chit chat.